Hello, my name is Reggie Chapman. I use he, him pronouns. I am the Director of Policy at the Fortune Society's David Rothenberg Center for Public Policy. Welcome to Both Sides of the Bars, which is a discussion driven show that looks at issues from various perspectives, including those most impacted by the system. Here we discuss critical questions about how the criminal legal system works, its intersection with social justice, and the efforts that advocates are making to affect everyone involved in this process. We ask that you, the viewers, spread the words about both sides of the bars and share your comments with us on Twitter, also known as X at the Fortune SOC. Today's show is titled The Public Health Impacts of Youth Incarceration. In today's show, we will look at youth incarceration as a public health issue and its effects on young people, their families, and communities. Research has revealed that incarcerating young youth disrupts their development, worsens trauma, and is linked to long-term health problems such as depression, post-traumatic stress syndrome, suicide, and chronic illnesses. We also explore how the raised age legislation and the Youth Justice Opportunities Act can act as public health solutions by reducing youth incarceration and expanding youth access to community-based alternatives to incarceration trauma-informed programs. This episode features Jonathan McLean, who has been at the forefront of advancing public health approaches for justice for years. Mr. McLean is the CEO of the Center for Alternative Sentencing and Employment Services, also known as CASES. He has led youth justice and reentry programs focused on trauma-informed community-based alternatives to incarceration for years. Good afternoon, Jonathan. We're excited to have you here at both sides of the bars.
Good afternoon, Reggie, and I am honored and it's a pleasure to be here and to be part of this esteemed show with you.
We understand that youth incarceration is a public health issue. It is not just a criminal legal system one. From your perspective, what makes incarceration itself a public health problem for young people and their communities?
Well, I think it's a great first question. I think the biggest issue, particularly in New York City and New York State, is the fact that youth incarceration disproportionately impacts Black and Brown kids. Anytime you take a disproportionate segment of the population out and you put them in youth detention facilities, i.e., Crossroads and Horizons in New York City, and back in the day when you were in a system and when I was in a system, Rikers Island, because there was no raise the age, then that is a public health crisis because you are these kids have been impacted by things that go above and beyond just the prison system, but things that impacted them in their communities, factors that put them in positions to be vulnerable to incarceration and the carceral system, and certainly a dearth of resources and support to keep them out of those systems and supports that are designed to fortify and build up strength. So that's the biggest factor. When you look at the number of young Black and Brown kids that are caught up in the system, that makes it a public health crisis.
I appreciate your thoughts, Jonathan. And when you say these things, you said a lot of things in there, but a few things I want to unpack for our audience. So you spoke about this community. You talk about affecting Black and Brown kids in a specific community. So essentially, there are a vulnerable group. You also spoke about this idea of other factors, which I think what you mean is like the social determinants of health that drive these factors, that create conditions for these people that lead to the crisis. And in addition to that, how it always affects the community. And so for me, and for what I think you articulated, was that these are some of the reasons why it's a public health issue. There's a vulnerable population. They are affected by the social determinants of health. And these effects are not just situated on the individuals in that space, but they affect the overall community. So thank you for the analysis, Mr. McLean. So next question. A lot of young people entering facilities already carry heavy adverse childhood experiences. My question for you is that how does incarceration re-traumatize them? And what are some examples of that re-traumatization you've seen in your work?
Yeah, I mean, I think the biggest thing is safety, right? It's very difficult. One of the prime stresses or things that impact people and that facilitate trauma stresses is not being safe. And many of the young Black and Brown kids, right? And I'm going to focus on Black and Brown kids because they are disproportionately impacted, come in from unsafe circumstances and find themselves in unsafe situations. So that exacerbates the trauma responses. So I think that's one of the biggest things for a lot of young people, and I would say not just young people, but people in general. If you find yourself in a jail or a prison or a detention center, there's a good chance you're not going to get the kind of behavioral health and medical health and support services that you need to be successful. So you come in, you find yourself in a precarious situation where you are constantly dealing with threats, right? Maybe from the police, the COs, other people in the system, and then you have all of these needs that are not being met, particularly around your behavioral health and your medical health. I mean, I think this is the golden thread. Things may have changed from the standpoint of uh, what the system looked like back in the 80s and 90s, but the conditions are the same. Black and brown kids, black and brown people, unaddressed needs, and systems that being in a system that actually exacerbates trauma and re-traumatizes people, because you can never truly be safe in a jail or a prison, and that remains true today.
Well, thank you for the analysis. I really, really appreciate that because you segue into so many of the things I would like to discuss with you throughout, this conversation. One of the words you mentioned, I think is very, very important is safety, right? The question was like young people coming into this space. Well, what research has shown is that a lot of young black and brown kiddies that come from divested urban spaces, they've been lived in and were born into unsafe conditions and they've been exposed to a lot of the adverse child experience, lack of parenting in the home, no access to food, healthcare, and just feeling unsafe because of those variables, right? All the interactions, violence that may occur in the home, violence that they may see. And then when they come to the carceral space, that same violence is there. And it's even a little bit more intense because it's a confined space and there's really no oversight to protect kids and to provide them with the service that they need that more than likely had they got prior to incarceration probably would have mitigated and or prevented them from getting there in the first place. And so for me, when you mention safety and you also say the golden thread, I love that you articulate that because that is something that our audience and the larger society should be aware of. That like safety is one of the most important things when we think about young kids. And so sometimes, at least historically, society has framed them as being threats to public safety when in fact they were the ones who were not safe in the first place. So I appreciate your analysis and I hope our viewers can, get a good look into that. I also want to double back on something that kind of ties into this question. So we talk about like the trauma that youth face prior to incarceration and then when they come in the system. So research has actually linked incarceration to long-term depression, PTDS, PTSD, suicide risk, and chronic disease among youth. Can you walk us through what you see clinically or programmatically that connects time in custody to these kinds of outcomes?
Yeah. So I think, again, so let's start with the safety factor. In order for young people to survive, and I think as difficult as it is to see some of the behaviors that young people deal with clinically, these are actually fight or flight responses, right? When you come from a situation where you've been traumatized and you're adapting to how you deal with this trauma, you are always in a constant state of war, battle. Either people are your friends or your enemies, and all your responses are shaped around it. That's your coping mechanism. So, clinically, what you see are kids who externalize behaviors more, who have a very difficult time maintaining relationships with others. Either you're my friend or you're my enemy, right? But these are all normative sort of trauma responses in the environment. When you're in the war, you have to operate like you're in the war. And being in prison not only exacerbates that, because again, you're always in a situation of constant threat. The other thing that prison and jails do, detention, is they take away your personal agency. Even in the streets, even if you're struggling in the streets and you're trying to find your way as a kid, and I know this personally, but from a clinical standpoint, when you look at young people, jails and prison make it worse because the whatever little agency, ability to make decisions on your own, have some autonomy over your life, is taken away from you in prison, and then you're really put in a position where not only are you in a constant struggle to fight for your life and fight, right, or flight, you also don't have the ability to exercise personal agency, which is a really critical tool for self development, for self efficacy. You need to be able to have the autonomy to do things on your own, to practice doing that, to feel like you can do more so that you can build a confidence in the ability to do other things. You don't have that in prison. And then there's these reaffirming messages, right, that really impact the way young people think about your worth. You can't make decisions on your own because everyone is making them for you. There are these messages about who you are, what you look like, where you come from. And then there's the constant threat to your well being. So clinically, it's manifesting itself in kids, externalizing behaviors more, exhibiting these symptoms of trauma, disassociation, clinical depression, suicidal ideation, self harming behaviors. All of these things are manifestations of the things that young people deal with to cope with the trauma. Sometimes from a clinical standpoint, kids self harm, right? I used to see this a lot. I spent many years working in child welfare, and it isn't necessarily because they're trying to kill themselves, it's because they're struggling with how to cope with their circumstances and to try to center the pain that they're feeling. And all of this stuff is terrible stuff, but it really manifests itself in a lot of harmful ways for young people. And the longer you keep young people in these circumstances, the more pronounced these behaviors play out, they exhibit themselves, and the more detrimental they are. The one thing that I'll say is that you got to give young people credit for surviving. You were one, and I was one. So you find a way to survive in those circumstances, but it's almost like coming home from a war, a soldier coming home from a war. And that might not be the best analogy, but from the standpoint of how you operate, right, when you get home, is what our kids are dealing with. They are put in situations where they're told that this is peacetime, but they operate from a standpoint that I am always at war. So it's very difficult to maintain relationships when they didn't have them. When you think about the ruptured attachments that young people have coming in, I always tell a story. I worked in foster care with young Black and brown kids, and I had kids. I remember a young girl who was 12 years old who had been in 13 different foster homes. So how could she have possibly developed a relationship and a rapport, a formative relationship with a caring adult in her life if she never had it growing up? And all she knew was disruption and displacement. You know what I mean? So all of these things play out and they exacerbate behaviors. And then what ultimately happens is if you're coming out and you're a young person that's trying to cope with racism, with all of these things, you find yourself in a situation where you're responding the way you respond if you were trying to protect yourself, right? In normative society, but it's not accepted. So there is nothing redeeming or edifying about keeping young people incarcerated. There is nothing that's going to help them better themselves. You know this, and I've heard you say it, and I know it. If anyone who comes out of that system better, they don't come out of that system better because of it. They come out of that system better in spite of it.
Spite of it. Absolutely, sir. Thank you, Mr. McLean, for providing that perspective. Just speaking about youth incarceration and like it being a social determinant of health, and like oftentimes, as you and I know, when a person is incarcerated, they lack poor access to healthcare, nutrition, and gaps to treatment and services for various reasons, like just um, poor access. And we're not just talking about physiological health, we're talking about mental health. So the lack of access to healthcare that a person didn't have in there, again, it's tenfold inside the carceral space for many reasons. One of which is that your judicial system doesn't good job of providing that. And young people and many people are skeptical of that treatment of staff within the carceral space, and the gaps of treatment just like lends itself to long-term problems. So considering that, my next question is that, in your role in cases, you're building trauma informed alternatives to incarceration program. For my question for you is, what does a truly health promoting alternative to incarceration look like for a young person compared to what they've experienced in jail or detention?
That's a great question, Reggie. I think the first thing that I want to say is that pris- uh, poverty, um, behavioral health issues, poor health outcomes, those are not crimes, those are conditions. And there is a fundamental problem with the idea of treating those conditions in a institutions that's designed to punish people. So jails and prisons have become the de facto mental health facilities, medical facilities for poor Black and brown kids, and for anyone who comes to them and you happen to be poor. But they cannot meet those needs, right? So kids often go into those systems having histories of not having those needs met in communities where they're not resourced appropriately, or they haven't been identified as kids that need the support, extra supports, or the supports. I don't even want to say extra supports. And then they get an assistant that isn't designed to provide those supports. So it exacerbates it. But with respect to what we do and what we endeavor to do at any trauma informed program, I mean, this is not us. The first thing you want to do is you've got to create a sense of safety. You've got to engage the kids in ways that culturally connect to who they are, where they come from, and begin to facilitate that agency by affirming their self worth. I'm not going to come in and be able to talk to a kid about what he or she needs, right? A young person, if I don't make that connection between who they are, first and foremost, and do everything I can to help facilitate a sense of safety, right? You have to help me define what that is. So I have to support you in you engaging your agency to tell me what you need to be safe. Because you're not going to be able to engage in any services if you don't feel safe, if you don't feel supported, you don't feel validated. So those are the fundamental things that we try to do. Keeping you out of jail is one step, not the whole trek to keeping you safe, but you should be able to operate in a better place in the community. Not always, right? There's issues around gangs and stuff like that. But the point is, the idea is to create a safe environment for the young people to be able to engage freely in. Then the next step is to engage them around who they are, right? This is where peers, youth navigators, young people with lived experience come in. You've got to be able to meet people where they're at and give them the ability to weigh in on what they need. That's the other step. The other thing that I think is really critically important are making a commitment to long-term engagement. Now, that's not always easy to do given how programs are weighed out, but no one makes progress. Progress is never linear, right? You and I both know this, man. You get out there, you bang your head, you find your way, you take one step forward, you take two steps back. Sometimes you have to find yourself through trials and tribulations, through banging your head before you find yourself. I always say to people, when I got locked up at 16, if someone would have approached me with an intervention like an ATI at that point, it wouldn't have helped me because at that point I wasn't ready for it. But there were certain intercepts at 14 and 13 that would have mattered. You know, like when I got that eviction notice, and my pops got hooked up on crack, and we got kicked out of our apartment, where an intervention might have helped. And then there were certain points afterwards when I got locked up where an intervention would have mattered. So the point is, we've got to make it as a society a commitment to giving young people room to find themselves and committed to staying connected to them and developing that engagement and rapport. Additionally, and these are all of the other things that you have to have programs that build skills. You've got to help people, right? Young people who have been traumatized, right? You talked about ACEs, right? Adverse childhood experiences with multiple traumatizations. They've got to develop coping skills, right? If my only coping skill is to pick up a knife if someone threatens me or to ball my fists up, I'm not going to be able to hold down a job. I'm not going to be able to make it in society. So I've got to develop some cognitive coping skills, right? Rewire my thinking so that I can get out of that fight or flight syndrome or a mindset and begin to recognize that everyone isn't an enemy and that everything isn't black or white, friend, friend or foe, and that there's shades of gray, and that I have to be able to comport myself in different ways. But that doesn't just happen. Those are skills that need to be helped to build. Then the other thing is you've got to give young people something. I always go back to this analogy. I remember the movie Malcolm X. I'm old enough to remember that. Elijah Muhammad put the cup on the table. He had half a cup of dirty water, and then he asked Malcolm, "What happens if you put clean water in the dirty water?" Well, instead of having a half a cup of dirty water, you end up with a whole cup of dirty water. If you want young people to grow and thrive, you have to give them something different, exposure to something different, to something more. I know you know this. I know this. In order for us to grow out of our situations, we needed to redefine the boundaries of our understanding and open ourselves up to new things that we did not experience. And I think that's critical for young people. So they need to be exposed. They need exposure. They need to develop skills. They need to build those skills. They need opportunities. And they need long-term engagement, safety, supports that affirm who they are, what they look like, where they come from, and an opportunity to grow and thrive. So those are the things that we try to establish to a lesser or greater degree, depending on what we're dealing with in an environment. We may not always get it right, but we know Those are the ingredients to help young people get to where they need to get to. And I want to just focus specifically on a long-term engagement. We give up too quickly on young people, man. We give up too quickly when they fail. We give up too quickly when they don't meet our expectations. When the reality is, we should be working with them around defining expectations that work for them.
Thank you, Jonathan, for providing that. You said so many things during that response that I would love to highlight for our viewers. But like, there's one thing that you said that I think is very, very important when we consider the topic in which we're discussing and respect to what cases does. You mentioned this several times throughout your answer. You mentioned early. You mentioned catching people early. You mentioned about even using yourself example, how when you're 16 and 17, it was difficult to reach you, but had society reached you when you got evicted or when your father got hooked on drugs, that mattered. That's early intervention, which is a staple of public health because it's about prevention. It's about social determinants of health. It's about injury prevention. And so when you articulated what cases does, I begin to think, because I'm a public health researcher, and I begin to think about the next set of questions, which is this idea of like public health solutions, considering two bills in which I want to speak to you about. But when you talk about what cases does, it just makes me think of that. And it really shows that like cases is on the right route when it comes to public health and how we frame this issue as an intervention, as a prevention, and we talk about the social determinants of health. I have a similar story. I was in trouble at a young age, but had I the intervention's been there when I was 13 or 14 when my mother was suffering from mental health issues and had to be hospitalized, or when my father was hooked on heroin and lost his life. Had I've had supports then that would have been preventative in nature and work with me, then maybe I wouldn't have gone down the path in which I went down. So I just want to highlight to you that for our viewers, because I think that's very important when we talk about the work we do. And just segueing to our next set of questions, it also speaks to about what cases represents as an alternative when we think about public health solutions. So on that end, I'll pose my next question, which is: research has framed both the Raise the Age legislation and the Youth Justice and Opportunities Act as public health solutions. How do you see both these laws changing young people's exposure to incarceration and their access to community-based support on the ground? Because I think you kind of spoke about that in your previous question. And for those of us that don't know those, I'll let you unpack the Raise the Age legislation and the Youth Justice Opportunities Act and what they represent as it pertains to preventing incarceration and providing young people with alternatives to incarceration through the multitude of programs that in which cases provides.
Well, to crystallize this for people, I'm older now. I'm 55, but I came up in the 80s on mass incarceration. I turned 16 in December of 1987, and I was on Rikers Island at uh, February of 19, turned 16 in December 86. I was on Rikers Island charged as an adult February 1987. So 2 months later, after turning 16, I was charged as an adult. There was no detention or youth facility for me. And I was on Rikers Island. There were tons of black and brown kids, 16-year-olds who were in prison, adult jail facilities like Rikers Island back then. So the thing that Raise the Age does is it recognizes the fact that at 16, there is no way. First of all, your brain isn't even developed, right? To the point that it needs to be developed to make the kind of executive decisions you need to make to be successful. But there's no way putting a child essentially in a adult facility is going to help that child grow or develop in any affirmative way, right? There is no question that it does nothing to support the growth and development of a young person, if that is what the aim is. So what Raise the Age does is it moves that age back from the age of 16, right? So now if you're a 16-year-old or 17-year-old, you're going to be dealt with in the carceral system, not as an adult, but as a young person. And a facility is ideally designed to help you with your growth and development, even as you work through your issues with the legal system, right? You're going to be in with young people. There's going to be services and there are going to be programs that are going to be designed ideally to help you. So that law safeguards young people. And when you add the public health issue of disproportionality, then what happens is you're beginning to safeguard young black and brown kids who are disproportionately impacted by this criminal legal system. and you're putting them in a position where they should be able to avail themselves to services. So that's the first part of it when you look at the raise the age legislation, right? It is certainly exceptions for certain kinds of crimes, but for the most part, it's to safeguard and protect young people whose brains are still developing from the harms of an adult jail system. The Youth Justice and Opportunity Fund is designed to infuse services and supports for young people in the community. The idea is that if you keep young people out of jails and prisons, which is what we believe in cases, not just young people, but people in general, you keep them in the communities, you keep them connected to their families, you give them the supports that they need, you feed them, you help them grow, you address the needs, right? Those unmet needs, those social determinants of health that you talked about, then you put people in the best possible position to be successful. That fund is designed to provide community based services for people, young people, so that they don't end up in these systems. Jails and prisons should always, 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 always be the absolute last resort. And if we haven't done everything we can to keep young people out of jails and prisons, then we not only fail those young people, we fail their families and we fail their communities. So, on the one end, you protect young people by keeping them out of jails and prisons, and then on the other end, with the fund, with the Youth Justice Innovation Fund, you are infusing the community with the kind of resources and supports that they need in the community to be successful and to safeguard them from going to jails and prisons.
And thank you, Mr. McLean. I appreciate that. I would like to ask you several more questions. Unfortunately, we're up against time,
And stop calling me
and
Mr.
I
McLean
wish
because
we
you're
could
my
ask you
brother.
more.
Call me Jonathan. You're my brother, brother, brother.
Yes, brother Jonathan. Thank you. Thank you for. I want to say thank you to you for providing us all your insight. I want to say thank you to our viewers for joining us for a thought-provoking discussion. On the behalf of the Fortune Society, I want to thank you so much for tuning in to both sides of the bars. If you're interested in finding out more about the Fortune Society, please check us out on the web at fortunesociety.org. That is the fortunesociety.org. Or on Facebook by typing the Fortune Society. This is Reggie Chapman, and I appreciate you for joining us for critically looking at both sides of the bars. Thank you.